Most fevers are harmless, but if your fever lasts more than 3 days, there is one mistake many people make that can actually delay recovery or even make things worse. And it is probably not what you think. Let us understand this clearly. First, fever itself is not a disease. Fever is your body's defense mechanism. When a virus or bacteria enters your body, your immune system increases your body temperature to fight the infection. That rise in temperature is a protective response. In most viral infections, fever usually lasts 2 to 3 days. It gradually improves. You start feeling slightly better. Within effervescent fluids, the body recovers on its own. So, if you are on day 1 or day 2 of fever, in most cases, there is no reason to panic. But when fever continues beyond 72 hours, the situation needs more attention. If your fever is still present after 3 days, it could mean that the viral infection is stronger than usual. It could mean that a secondary bacterial infection has developed. In some regions, it could be illnesses like dengue, malaria, or typhoid. Sometimes it may simply mean that your body is dehydrated or exhausted, and recovery is slower. This does not automatically mean something dangerous, but it does mean you should start observing your symptoms more carefully. Now, this next part is very important. If your fever continues and you notice severe headache with pain behind the eyes, or repeated vomiting, or extreme weakness where even standing feels difficult, or breathlessness, or unusual skin rash, or small bleeding spots, or very little urine output, or confusion and unusual drowsiness, you should not ignore these signs. These are warning signals. Not every fever will show them, but when they appear, medical evaluation becomes necessary. Now let us talk about the mistake many people make around day 2 or 3. They start antibiotics on their own. They take leftover medicines from home, or they stop medicines halfway when they feel slightly better. This is risky. Antibiotics do not treat viral fevers. Taking them randomly can delay the correct diagnosis. It can temporarily suppress symptoms and make the condition confusing. Over time, it can also contribute to antibiotic resistance, which makes future infections harder to treat. Instead of reacting in panic, here is what you should do if fever crosses 3 days. First, observe the pattern of the fever. Is it constantly high? Is it coming and going? Is it slowly reducing? Second, make sure you are drinking enough fluids. Dehydration alone can make fever feel worse and delay recovery. Third, carefully watch for the warning signs we discussed. And finally, if the fever continues beyond 3 to 4 days, especially with worsening symptoms, consult a doctor. Sometimes a simple examination or basic blood tests can provide clarity and prevent complications. Remember this clearly. Most fevers resolve naturally. A prolonged fever requires observation, not fear. Warning signs require action, not delay. Your body usually gives signals. The key is knowing which signals matter. And if you are thinking about starting antibiotics for a fever without proper advice, you should watch the next video where I explain why antibiotics do not work for viral infections and when they are actually necessary. Stay informed, stay rational, and make health decisions based on understanding, not panic.